Okay, so welcome everyone on this series of COVID webinars that we are having from the Department of Telemedicine. Today we have for you Professor Debashish Basu, who's the professor and head of Department of Psychiatry in PGI. And he is going to be talking about psychological effects of COVID on children, as well as he will discuss on other people as well. So we are now going to Dr. Debashish Basu. I'll request Dr. Meenakshi to formally introduce Dr. Debashish and also note down the questions on the YouTube chat box as they would appear.
Thank you, ma'am. It's my privilege to welcome Dr. Debashish Basu, who is Head of Psychiatry Department at PGIMER Chandigarh. And we are conducting these webinar series under the aegis of ICMR Evidence-Based Medicine Center at the Advanced Pediatric Centers, PGI. Dr. Debashish Basu, his main areas of interest are quality of life and substance abuse. His current projects include neurophysiology in opioid dependence, profiling of dual diagnosis patients in Drug De-Addiction Center. He has recently formulated interim SOPs for running a hospital-based opioid substitution therapy service to manage patients during COVID-19 outbreak and lockdown times. Today, he will deliberate upon COVID-19 and psychological issues in Chandigarh, in children. So over to you, sir. You can share your presentation now.
Thank you. Thank you very much, Professor Madam Minu Singh and Dr. Meenakshi and all others who are organizing this. It's my pleasure and honor to be here to join you on this series of very important programs on various aspects related to COVID-19. So today, as has been introduced, I'm a psychiatrist, although I work more in the area of addiction psychiatry, but of course, we work in all the areas of psychiatry, and children and adolescents are an integral part of psychiatric issues. And particularly today's focus is, as has been talked about, will be on the psychological and behavioral issues which are seen in children during the COVID times. Not necessarily that they are affected by COVID themselves, but much more often than not, they are affected psychologically in many ways that we are just going to talk about. And the second half of the talk will be about what are the things which can be possibly done. We can't do everything, but what are the different ways, particularly for parents, particularly with a focus on the parents, because they are the ones who face a lot of difficulty, and also school teachers and also mental health professionals and others, can be done about the situation to the extent possible. So with this brief introduction, I'll start sharing the screen. So okay. I think I should be able to, yeah. So now I think we have gone into the slide show view. Somebody will have to let me know if the slide transition is happening, because yesterday I was in another talk and I found out that the slide transition was not happening. So every time I had to escape and go to the other mode. So I'm just going to shift to the next mode. I mean, this is just an overall slide showing the different aspects of how the children have been affected by COVID. This is just a kind of a snapshot, really. We are going to go into more details of this. So if I may ask, is this slide visible?
Yes,
okay.
Dr. Basu, it's moving.
Fine, yeah. Thank you very much. So that's fine, because yesterday it was a lot of problem. Every time I had to come out and escape. And anyway, so as this latest article in Indian Journal of Social Psychiatry shows, that mental health crisis among children is actually almost a parallel pandemic. And more importantly, and tragically, it's a kind of a silent pandemic. It's silent because we do not often talk about it. There are so many things to talk about during COVID-19, about the physical aspects and the mental health aspects of adults, of healthcare workers, of the family members, caregivers, etc., etc. The children, somehow they kind of take a hit, especially when psychological and behavioral issues are concerned. So we are going to cover in brief things like who are the children who get affected, what happens to them actually, what are the psychological issues which have been found in various studies. Then the more tricky question of how and why, what are the different factors, the various factors at the macro level and at the micro level, which impact upon children's mental health during this pandemic. A small section, but a very important section on what are the special issues in which I'll devote a little bit of time on a very important topic called screen time. And finally, what can be done possibly, as I say. So these are the rough navigation of the talk. UNICEF India last month, in its May 2021 report, the reporting period for 1 month, has drawn this very grim picture. This is only for India, the UNICEF India. The situation in numbers, 286 million children in need of humanitarian assistance, not only of mental, but also of all sorts of humanitarian assistance. And all in all, 664 million people in need. This is just the month of May, which of course was the peak period of the second wave, as we all know, but this is no mean number. The figures actually vary a lot. The figures of the psychological issues vary depending upon whether we are talking about those with pre-existing physical or mental health conditions, or whether those who have been previously healthy. The picture varies quite dramatically between different age groups. Infant and toddlers, as we all know, I'm talking in a pediatric group, so I don't need to overemphasize it, that their behavioral patterns will be very different compared to the preschool group and the school and the college going or the late adolescent group. It will vary. It will depend of various socioeconomic background and the levels of adversity, especially those who are street children, never school going or dropouts, child laborers, children of migrants, those experiencing family discord, violence, alcoholism, domestic abuse. All these things can have kind of a domino effect on the children's mental health. So these are the special adversity level groups. And whether they themselves the children have been affected by COVID-19 or their family members, which is a very important area, because then they'll need isolation or quarantine, or one of the parents is in hospital, and worst situation, of course, one or even both of them are dead, so etc. And finally, as I said, experiencing death in family due to COVID. All these factors will kind of impinge upon the figures. So the figures are not that important as to understand the nitty-gritty or the granularity of the figure. This is one of the good systematic review and meta-analysis. Rather than going into individual studies, I thought that we should just focus on one of the good. There are multiple reviews actually, but this is a good of a good quality one, which took 15 eligible studies of moderate to good quality, with almost nearly a 23,000 samples. So a large sample, of course, a global sample. There was only one Indian study included in this meta-analysis, but nonetheless. So and they were talking about common psychological or behavioral issues, not necessarily disorders, because these were, as you can understand, they are all online surveys, practically all of them. And in online surveys, you have to use simple screening questionnaires, which catch more of the issues rather than an ICD-10 kind of a disorder, right? But it does give you a fair enough idea. And these were based on mostly healthy volunteers of school-going age. So in toddlers, picture will be different. The main figures are this. You just look at the pooled estimates percentages, and you'll see what huge figures these are. Practically one in every, depending upon which condition we are talking about, 1 in every 5 to 1 in every 3 or more would have some or the other psychological issues. And if I can show this, if I can just use the annotate figure, I'll just try to use the spotlight. So if you can use this, then you can see that any psychological figure is as high as 79.4%. That's a tremendous figure. That's nearly 4 out of 5, right? Any kind of overall worsening of behavior, any psychological symptoms, primarily consisting of depressive symptoms. I'm talking about symptoms, right? I'm focused. It's not depression as a medical disorder necessarily, but depressive symptoms, anxiety symptoms, irritability, very, very common, very, very common, boredom, sleep disturbance, excessive fear, inattention. And also there was lot of symptoms in their family members and caregivers, which were also very high. So I'll just, yeah, okay. Oops, I think I've got this thing inside this well. So the when we need to kind of identify that which are more serious mental health issues due to ongoing pandemic, then these are some of the signs which have been talked about. You know, when there is persistent difficulties in sleeping and eating, persistent nightmares, being withdrawn or aggressive, either way, this way or that way, complain of pain in stomach, unexplained pain in stomach or headache without obvious physical reason, having fears, being afraid to be left alone, clinging, cringing, kind of dependent type of behaviors, and new fears manifest which were not there in the earlier phase and which are kind of age inappropriate, okay? Decreased interest in playing and all these kind of things. So the why and how would be that either the illness affecting themselves or their family members, or the measures taken to control the pandemic, like obviously lockdown, quarantine, isolation, school closure, a very, very important thing on which we are going to spend a few slides on this because it's very important. We know it's a double-edged sword. It's to keep them safe, but what are the fallouts of that? Lack of group play or meets in person, you know, going out, eating out, picnics, projects, parties, and all those things. So these are the measures taken to control the pandemic. And the third is the fallout of the pandemic in terms of economic hardship of parents, which obviously can have a knock-on effect on the children, the various kinds of stigma and fear of various kinds, and last but not the least, loneliness, which is in itself not a disorder, but it can severely eat up the child's mental space. A very important and a very recent, just this month, the June issue of Lancet Psychiatry has come up with this very important kind of a landmark article, global article called, talking about low income and middle income countries, Islamic countries, and reimagining global mental health. These are very huge article, and it has drawn a kind of roadmap about what are the things need to be done. The point, why am I bringing it here? And we have at least 2 Indians there, Shekhar Saxena, who was earlier the Director General of WHO Mental Health Division, and the last and the corresponding author, Vikram Patel, and also we have Soumitra Pathare from Pune. What they focus amongst one of the 7 actions that they have outlined is school closure. And they mention it as one blind spot in global mental health. Why? Because school closure is not just about talking about their school education. There are multiple other benefits of schooling, as can be seen in this slide, aside from the important academic benefits, because people keep on saying, that, okay, you make it all online, fine, we'll come to that. But they have an essential role in shaping the overall well-being and development of young children by providing a structured and supervised space for socio-emotional development, friendship, social support networks, protection from some of the risk-taking behaviors, and exploitative labor, because many of these after school in the deprived society, they are simply dropping out of school and entering the labor market because they have to earn money for their parents, because their parents are also out of earning, right? So delays to early marriage and childbearing, and gatekeeper services to detect and intervene early to reduce child abuse, amongst others. So there's a huge lot of other things which a school plays a vital role in a child's socio-emotional development. And they also, interesting, I mean, we don't talk about this in child health, but it's a key access point in many countries, including India. Many of those midday meal scheme and food for children in very poorer, low and other countries, income countries. Some of these programs are important not only for nutrition, but also for their cognitive development and also for getting them back there to bring them back. So in this pandemic might have this unintended consequence of increasing food insecurity among the children, which of course negatively affects their mental health. UNICEF India, again, relatively recently, end of 2020, they did this rapid assessment survey of learning during school closures. It's a very large report. So I'll just focus on one part of this, particularly in India. They found, this is the point that I wanted to focus on. I mean, there are many learning points, but this is important. Despite the availability of remote learning resources, through mobile and electronic devices across multiple channels, many students are not using these tools. They found that only 40% of students, 40% or 60% used, and 40%, 4 out of 10 students in the 6 surveyed states did not use any form of remote learning in the past 6 months. So completely out. Either they don't have that kind of a YouTube or channel or video, or they can't access, or they simply run out of money. I mean, one of the needs, I'm not showing it there, their most important need, they said that they need internet recharge, money for internet recharge. They have a cheap mobile, but they don't have the money. So all these are very important things. They all impact upon children and adolescents' mental health. And these are how. We have talked about the why. This is one slide on the how. This is again biopsychosocial, biological, environmental, and social factors. Biological factors also become important because all these kind of stressors, they impact upon, in this rather a bit of a busy slide, but you can see that on the left-hand panel, there are those on the left-hand panel shows the behavioral and social immediate consequences. Distress, hopelessness, irregular food intake, as we talked about, abuse and trauma, domestic violence, interpersonal and environmental restraint, and sensorial deprivation and neglect. Now, all these, they actually not only impact the psyche, but they also impact the brain in terms of neurotransmitters, neuromodulators, hormones, various pro-inflammatory cytokines, often working through epigenetic mechanisms. And going through this, there can be possible long-term consequences by causing epigenetic or hormonal changes by leading to an underdeveloped brain circuitry, obesity, substance abuse in later adolescence, okay, or young adulthood, lack of emotional processing, psychiatric disorders, and suicidal thoughts. So it keeps a trail, it simply does not end there. That's the point. And that's why it's so very important to talk about that. This is what that Lancet Psychiatry article that I referred to, this shows in their important panel, the takeaway panel. They says that one blind spot addressing the mental health of children and young people, one blind spot of global mental health has been its relative neglect of children and young people. More than 80% of the world's young people live in low-income and middle-income countries. Given how the complete closure of schools and colleges is directly affecting the lives of young people, building back better, as you know, the G7 and the United Nations, they're talking about this 3B theme, the building back better theme. The building back better with intersectional approaches must explicitly address this crucially important demographic group, the children and young adults, to promote nurturing environments at home, in schools, and across neighborhoods. This kind of sets really the backdrop. these are two things, screen time and orphan children. Unfortunately, I cannot talk about orphan children. It's a very painful issue, and very painfully, there is hardly any data or hardly any studies on that. We only have, anecdotes, and we know how they're suffering. Currently, as we all know, the government of India has disclosed or has come up with a plan to help the orphan children, but there are many ifs and buts about that. So, but that's a tremendously disadvantaged group, of course, people who have lost both their parents to COVID-19. What about screen time? A screen time, as we all know, is a time using any of those electronic screens, including TV, but also any of those electronic devices, starting from mostly mobile, but also other, all those electronic iPads and stuff like that. A latest this month's position statement by the task force on behalf of IACM is the Indian Association of Child and Adolescent Mental Health, has come up with this position statement. Again, it's a good article, but the major points, they say that there's a need to distinguish between normal use, problematic use, and addictive behavior pattern. This is very important to understand, because see, during the lockdown and the quarantine and isolation and school closure, essentially we are actually enhancing our screen time. We have to, and the children have to. They're studying using their laptops if they can afford one, if their parents can afford one, or through TV or whatever they are trying to do. So the normal use of all of our screen time has actually increased, right? So we have to understand that context. And then it gradually slips into problematic use when other kind of things start over, when the child is present. We'll come to that what are the red herring signs to suggest that now it is no longer normal, is becoming problematic, or even in certain cases becoming a behavioral addiction or an addictive behavior pattern. There is no clear-cut watershed line in between, but it's important. The signs include, we all know that, I think most of us can kind of get them by common sense, but here is a good list. Spending majority of the time engaging in digital media use, preoccupation with screen-based activity, overriding other responsibilities and social interactions. The overriding part is important. Using digital media as a coping strategy, just like an alcoholic starts using his drink not for recreation any longer, but as a coping strategy for emotional issues or to feel normal. So a child would use the screen for the game or going into that imaginary world, So that kind of a thing. Continued use despite physical or mental harm, like dip in grades, eyesight poor performance, concentration difficulty, etc. But still continue. That's one of the signs of addiction, really. Having problem in stopping use despite wanting to cut it down. Experiencing mood symptoms, irritability, depressive symptoms when not. It's a kind of a rough behavioral equivalent of withdrawal. Like when you're not using heroin, opioids, alcohol, then you are feeling like that. So when we are trying to cut it down, then those emotional symptoms, and not acknowledging or even minimizing or even hiding the extent of problem, and fatigue from staying up late or other behavioral afflictions, etc. In addition, if there are any changes in behavior observed, such as becoming upset after viewing something, at times they can latch on to pornography, for example. May not be knowingly, but unknowingly, you know that there are luring links which can take the child or the adolescent to dangerous sites. Not just pornography, but various other kind of dangerous, risky behaviors. Time to take professional help. And this is actually, interestingly, from the American Academy of Pediatrics of 2016, a very important guidelines document which they have used, which they call a family media plan. This was prior to the pandemic, but of course is relevant for all of us. Identifying screen-free zones. This zone, for example, during in the dining room and while eating together, there should not be screen. So fixed screen times. You may or may not. So the family has to agree. There are a lot of cultural differences. Okay, so in a specific context, but you have to have a plan. That's the point. Ensuring alternate pleasurable activities, especially focusing on physical activity. Parents should be quote unquote media mentors by choosing appropriate content, especially for younger children. Is very important. Quality time could include all those, other kind of good screen-based activities, playing a game together together. The important point is together, and discussing about safe and respectful behavior to have cut away from cyber bullying and cyber stalking and cyber trolling and all those things. And finally, very importantly, being a good role model for screen use by yourself, by ourselves restricting screen media use, except for professional purposes. Okay, so it can, because otherwise they are very good learners. Children learn the best by imitation, by watching. Okay, something known as just learning by watching. Builds fixed rules for social media use. Uh, Whatever is again appropriate in the context of that family. There are no golden rules for everything, but the point is that one should have a plan. Teaching safety rules, very important for especially children. Instructing not to share personal information on social media sites and encouraging privacy settings. And there can be, as many of these iPhones or other things, they come with this screen time duration calculator, which can be activated in devices to give an estimate, so you can have a monitoring. And finally, don't be scared to block and filter, filtering strategies in case you are worried. Those 5 golden rules. It's okay to block someone you are not comfortable with. Do not accept friend requests from strangers. This is for the children. Okay, if an email looks suspicious, do not delete it or mark it as junk. Particularly, don't click on those hyperlinks, etc. I think we all know this. So, but this is very important. These are 5 golden rules, as they say. Stay safe online. This is the. So what can be done about it? We have come to the last section. That is the what can be done about it. This is the Ministry of Health and Family Welfare in collaboration with NIMHANS Bangalore as a nodal agency of psychiatric aspects dealing with that. So they have come out with this. This is more than a year old actually now, but so it's called Taking Care of Mental Health of Children. Pretty simple things again. The major headings are: provide assurance wherever needed, keep them in contact with their friends. Don't by phone or by video call, but involve them. Keep them in touch. Manage your child's anxiety. Listen to them. Do not simply do not avoid their questions related to COVID or speak to them harshly. This can increase their fear and avoidance. So talk to them, reassure them, give them facts. Okay, give them clear information. You don't have to scare them, but give them reasonably age appropriate, developmentally accessible information about what is going on, so they know that it's something important, but at the same time they don't need to be panicky about it. Engage them in whatever indoor activities you can, depending upon your resources, and very importantly, make a routine of learning at home, a routine of playing, a routine of enjoying them together, etc. A very important document from UNICEF India and this group called Childline India have come out with a very big an 80-page document. I'm not going, but some of these are very important screens. So they have taken evidence based from UNICEF, CDC, WHO, etc., and come up with this very kind of parent-friendly and also friendly things, just with the 5 major points. The details are on the left-hand side, but the right-hand side says, for example, the first one is parenting quality time. So parenting, what is the quality time? Some of the examples are given there: age appropriately, baby, toddler, teenager, etc. Okay, young child. So different kind of ideas with them. Second, keeping it positive. Keeping it positive is very important to let them hear about positive stories, positive messages, etc. Again, in an age appropriate manner. Third, structure up. Put a kind of create a flexible but a consistent daily routine. It's a very important, and you are a model of your child's behavior. Okay, so that's very important too. So structure is very important. Honesty and openness when giving information, as we have already said. This is a very important part, because domestic abuse and exploitation against children has really gone up, and there is evidence of that from many countries, including India. If you see any of these situations around you, it is important, both as a humanitarian effort, but also under the POCSO Act or any of things, to actually inform people. You may call the 1098 Childline number, or if it's very serious, call up the police. You can call up the police if you see that there's beating going on, especially in that alcoholic husband, a very disruptive household, and the children are suffering because they're all stuck together. They cannot go out. They cannot have that free time in the school. They cannot. They are stuck in a hell. That is a time, if it comes to your knowledge, please do respond. This is a wonderful, this is an absolutely wonderful UNICEF, not India, but the not just UNICEF, is actually the interagency standing committee of all the United Nations agencies we are concerned with the emergency situation of emergency conditions. They have come up after consulting 104 countries, including India. They have come up with a book in some 36 languages, including Hindi, Punjabi, Marathi, Gujarati, Bangla, Assamese, and I don't know how many others, and many other international languages. A small 22-page book freely available, and a video also based on this called My Hero Is You. How kids can fight. Wonderful. It just takes that this child, Sarah, she falls asleep. She considers her mom, who is a mother, but also a doctor or a scientist. I think your mother is a scientist, as a hero, listens to story, falls asleep, gets into a dream, and sees this interesting creature called a kind of a dragon, like a friendly dragon called Aereo. And the Aereo takes Sarah up for this a tour all over the world, and sees, this is the Hindi part, you can see. Mere hero tum ho. Okay, so the whole story is available in Hindi. This is the Hindi part. So they go over the world, meet lots and lots of people, meets the doctors, the nurses, the healthcare workers, the police, how they're fighting against COVID. They learn from there, from different parts. This is the Hindi part I'm reading. Okay, so they have changed the Sarah to Sasha, which is more of a Hindi name, etc. And finally, the last page. She woke up, and then she tells mother that, oh, I have been to so many safe places, and says that, yeah, you can. And then she says that, Mom, you remind me that we can all be heroes every day, and my biggest hero is you. It's a beautiful. Everybody can use this. Okay, coming back to that UNICEF and the Childline book. This is the front page of that book. Again, a wonderful, beautiful asset which can be used, freely available. So these were all individual, right? Just one slide, 2 slides on the Kerala model. The Kerala model this is a structural model. Okay, this is a systemic model, because as you know, in Kerala, the mental health and the health system is very good. They have implemented the district mental health program in each of the districts of the Kerala state. So what they did is that they found, and there are district mental health officers. Okay, so based on that, this was way back in March, April, they did it. They found a program called, I can't pronounce it properly, pardon me, it's called Otakalla Uppamundu, basically saying that you are not alone, we are with you. They made a program that how their psychosocial, the PSS team, the psychosocial support team, made reassurance calls to people, to the children, the families, to find out if there are psychological, as a screener, psychological symptoms and their social needs. And based on that, either telephonic counseling, or if it's more, then visit and further tap. Very simple, doable system, but you need to have a system for that, which I don't think in Punjab and Haryana we yet have. But it's important to know that this is possible. This has been done in India. We'll end up with just a few slides, cover slides, not the whole studies from PGI. I mean, there are many studies from Delhi, Punjab, Gujarat, Bengal, various places, but published in the Indian Journal of Pediatrics a couple of months ago from our department. Parents of survey, online survey of parents of children attending the online classes during the ongoing COVID-19 pandemic. They found that the online classes, they were not comfortable. 80% found they were not very helpful. About half of them thought that the children are actually not being. Interestingly, there's a study, I'm not showing it here. There's a study from Eastern India, Odisha, which have actually shown that they felt that they were very good, but that was the initial phase. Children were enjoying that they don't have to go to school, that they were enjoying and all. This is much later. This was done in the August, September, the peak of the first wave pandemic, and things were very, very different. We need longitudinal studies for this. This is another study from our department on ADHD, attention deficit hyperactive disorder, and their families, online survey. They found that giving text messages every weekly, 3 messages per week over 3 weeks, a series of messages on how to manage, how to identify, etc., was helpful. So that was a continuity of care model when the OPDs were closed. Okay. A very kind of a pathetic short paper in Asian Journal called A Narrative Experience. This was the COVID, the NHE ward, where Swapnajit and Asim, our team, they're posted there. And these were children who were actually, who were admitted in the NHE and not admitted. One of them was kept in I think in isolation, and the father was ill. So they say they made, this was a narrative thing, okay, just a qualitative. So the narrative experience one, the unending questions of the 8-year-old girl, will my dad survive? And they had to deal with that. Okay. And the second one was, Papa, where are you? Just wanted to talk to the father, which they made possible. Initially, they were not allowing the video calls. They said, no, you allow the video calls and other things. And the PPE, they were getting very scared with the people in the full-blown PPE attire. They were so scaring. So they suggested that, why don't you put your name and put something which is interesting, so the person knows that there's a face behind that that Ajib sa looking figure. Okay, this is from the Department of Pediatrics, Madam Prabjot Malli and team. Again, in pediatrics, stress and parenting during the COVID-19 pandemic. Again, an online survey found that there was, understandably and not surprisingly, a high level of stress in parenting. I think this is the latest one for which only the protocol has been published very recently. Dr. Madhu Gupta is from Department of Pediatrics, and she's I think the main author, and Dr. Sandeep Grover from here, Dr. Prabjot Malli, a multi-component intervention to reduce screen time amongst very young children, 2 to 5 years. This is a protocol. I think this study has just started. I think these are a whole series of resources. There are wonderful resources, but I've just put it up in case somebody is interested. One can take out, especially the UNICEF India, and some of them are very good. I can share with you later. I think I must stop here now. I have come to the end of my talk, and will take any questions and any feedback from you. I would also like to learn from you. Thank you very much. I'll stop sharing now.
Thank you very much, Professor Bhatt, for your masterly handling of this very complicated problem which we are facing these days. That is about children facing psychological issues because of COVID and all the alterations which have taken place in our lifestyle, the new norm which is there for children who are unable to cope up and understand what all is going on around them. So I think you've flashed some very important points which need attention, and these are, of course, now the school opening, which is an important consideration, and another very important issue of screen time, which is, as you said, is acting like heroin in some of these children, that they get dependent or addicted to this. So these are some of the very important issues. So I want to ask you a question. These days, there is a lot of talk about preparation for the third wave. And we know that we now have experiences behind us during the second and the first wave, what happened to children. So what would be your suggestions for preparations for the third wave as far as psychological issues for children are concerned?
Right. Thank you very much, madam, for your kind words. And I hope that I have been able to do justice to at least some of the issues. As you said, it's a complicated, multi-layered, multi-dimensional issues. The picture is very different from, as I said, depending upon various socio-demographic conditions and many other conditions, right? So the third wave. Well, of course, one of the first lesson is about physical part before we come to the mental part. It's important because children and young adolescents particularly are very, that's the age, as we all know, that's the risk-taking age, right? That's the impulsivity age. They tend to forget that what all happened in the past, and they very quickly come to that, oh, sab kuch theek ho gaya. So again, very quickly the masks are off, and all those social distancing and all those social COVID appropriate behaviors tend to come off very, very, very fast, which we are already kind of observing in a manner of speaking. the first and foremost from the mental health, all the health practitioners, not just mental health, as well as from the school teachers and the parents together, is to keep on reinforcing this, especially given that their risk prone behavior because of their age and their developmental stage, to reinforce that this is not the time to give off, come away from all those COVID appropriate behaviors. We all know what are the COVID appropriate behaviors. That is the first and the foremost thing. That's a physical point. Second, I think would be a practical suggestion about this is a time to get into the mode of new normal, to realize that we have to embrace the digital age. We cannot any longer afford to look the other way around. Even if the school start, there are so many other apps and so many other things, all those coaching, etc. They all work online. So it's better to actually, even for the parents and for us who are at times technologically challenged, to get an idea about what is happening and how. Okay, because one of the things which they said in that survey, which was done, they said that a lot of time they're spending on other internet surfing. They are not actually spending on the school studies, because the parents don't know. They're from a very different class. वो बच्चा कुछ पढ़ाई कर रहा है, वो लेके बैठा हुआ है. So it is very important to us also get into a bit of digital literacy at all levels, because devices are relatively cheap and they are still, other than a very low economic class, they are affordable. I think that's the second point, because we have to get into terms with the realistic new normal. The third point I would suggest is that as the school opens, the schools, that is for the schools, the school teachers, along with COVID appropriate behaviors, of course, they will have to do that. But at the same time, they have to focus on the other behavioral and mental health issues, which, as we said, that Lancet Psychiatry article, not just the studies. School is not only a space for study. School is for making of a man, making of a person, those focus must also be there, so that their mental health is given that importance, which unfortunately, which often gets under the carpet. I'll stop at these 3 points at the moment. We can take up more. Thank you.
As we know, a lot of parents use the mobile phone, as a child minder. They would just give it to the child so that the child gets busy.
Yeah.
And I think this is something which really promotes this dependence on screen of the mobile phone. And then there is a possibility of their surfing other objectionable sites, etc. So I think the parenting part is extremely important, and we have to actually counsel the parents.
Extremely important.
As far as the schools are concerned, Dr. Basu, I have always been saying that our school curriculum is very, very overloaded, especially for the initial classes which are there. So I guess now the schools have been closed for some time, and I think a number of educationists must have had time to think about how we are going to reintroduce these practices and make the schools also absolutely healthy and something which actually promotes overall personality development, which doesn't happen in most of the schools. Actually, they are so much worried about fulfilling the CPSE curriculum,
just
and all
pushing the curriculum, just pushing through the curriculum.
Curriculum. So I think this would be a good time to even think about that. And once we get into schools again, we should get into healthier schools rather than the same old rote teaching, which
absolutely. I entirely agree with you. And madam, actually, this is, as some people have said, I have not showed that. Professor Rajesh Sagar, very famous child psychiatrist from AIMS, Delhi, he has written an article in Indian Journal of Pediatrics. They're all appearing in pediatrics journals, and good, and he says that some of the positive aspects of spin-off of the COVID-19 for children. One of the points he makes is that let us learn learn what we did badly and what we should do better now. One of the points, other things, is to make the schools safer, because bullying and other things can happen in schools if the teachers are not careful, and also to make them more create the space for their mental and psychosocial growth along with the hardcore studies. So same point. Yes.
Dr. Sachdev, are there any questions in the chat box of YouTube?
Ma'am, there are no questions, but I have a basic question from sir.
Yes.
Sir, first of all, thank you so much for taking such a pertinent topic. It's very important.
Thank you.
And sir, as parents, like, how can we cope up or manage the emotional distress or anxiety during these testing times? Like, how can we counsel our children at home? Any tips or any suggestions?
Yeah, there are very good question, Dr. Meenakshi. There are two parts to it. One is managing, being aware of and managing our own anxiety, depression, helplessness, anger, hopeless, all those kind of negative emotionality, because that's the first part, really. That's the part one. Because unless we can do that ourselves, what will happen very commonly is that our anxiety, the parental negative emotionality will just brush on the children. That's what happens. Because if we are doing like this, what will happen to the children? They learn by imitative learning very soon. So that is one, that we have to learn to identify our own emotions. If there is if you are getting too anxious, you take your time out. Do not express your own negative emotionalities in front of the children. At least talk it out between the spouses in a separate room, where not in front of the children. If one has to fight, it's all right, because I'm yet to hear of any parents who have never fought in life. I think they're lying. So we all fight, we all have discords, we all have problems, we all have discussions, arguments. Let that not happen. Let that not affect the child. Let that take place separately. If there are economic, financial hardships, that's a much more tougher question. How do you counsel a migrant laborer who has lost his job and is walking back 1,000 kilometers? All those extremely tragic stories. What do? We really have no answer. At that time, you need food. Right now, right at that time, you need food, shelter, and kapra. You don't need those. Become the higher requirements at that time. We are here talking about people who we are assuming have those basic things, but they're still but they're still anxious and kind of insecure. So first is be aware of your own emotions, insecurities. Keep it to Talk it out amongst yourself. If necessary, you can access counseling at your own level without affecting the children. That's the first part. And the part two is that for the child itself, communicate with the child, listen to the child. Listening is something which we often don't do. We advise them before we start listening to them. The child may have a very different concern, a very different need, an emotional need, than what we think that the child has, what we are assuming that the child has. Let's not assume. The child may be afraid of something very different than what we think the child is afraid of. Let's listen to the child, the concerns, give them realistic hope, and then uh, comfort them, distract them, use them, be with them for play, for games. Those details are there which are age appropriate, because same thing with a 2-year-old child or a toddler will not be the same with a 15-year-old adolescent who is acting out and trying to have some beer with his friends, or going out on the motorbike or something like that. Very different scenarios, right? Extremely different scenarios. But the principles are of listening, communicating, comforting, and controlling, but in a gentle manner, without being totally controlling on them. And if it goes to a more severe extent, as I gave some red herring signs, if you think that there is a mental health disorder is appearing, persistent insomnia, persistent lying, persistent change in appetite, persistent change in behavior, extreme degree of irritability and aggression, etc., more than what the child was earlier completely, then it's time to take mental health professionals' help.
Thank you, sir, for your advice. So there's one question by Dr. Manvi Singh. What is screen addiction and how common is it?
Okay. Again, all these terms, addictions, like the term internet addiction, screen addiction, social media addiction, these are not, we have to understand that these are not technically correct. I mean, these are not medical terms, right? These are terms which are used in the lay media. The medical term which has been accepted in ICD-11 coming up, that is called a gaming disorder or a gambling disorder. We don't have a term like a screen addiction. But what is meant basically is that a person is glued to the TV, glued to the internet, glued to the mobile or the internet device or anything else for an inappropriate time, for a time which is much more excessive than what is normally, what is his usual background. More importantly, where it is more beyond professional use, because professional use we are all using. We are all right now. We are using the screen, right? I mean, so we cannot call this an addiction, obviously. But for a child now, online classes, that is a professional need. Even a gaming is a need now, because what will a child do? But if the gaming goes on for 4 hours, 6 hours, some of the like the American Academy of Pediatrics again and WHO, they have given cutoffs also. So they have given some cutoffs. Okay, for example, 2 to 5 years, they have mentioned that it should not be more than 1 hour. Now, Dr. Balhara and other people, including myself, we have questioned that. We have said that you have to contextualize it. You cannot make a single cutoff, because nowadays people are using more time. Rather than that, I mentioned some of the behavioral indicators. Those are much more indicative of an addictive behavior, like if it is using for a coping, if it is making the child irritable, withdrawn, angry, throwing up tantrums, temper tantrums, showing disruptive and violent behavior. If those kind of things are there, neglecting other activities, neglecting food, neglecting sleep, then that is suggestive of an addictive behavior pattern. And what is to be done for that is, again, I talked about the family media plan. There are other internet addiction plans, essentially to curtail the internet use, the screen use, to appropriate timings, set limits on them, not completely stop them, because that won't work and that's not desirable, but set realistic, workable limits on them, reward the child when that is working. Everything works by reward and punishment. Punishment is not a very good idea unless it comes to that. We'll come to punishment, but reward is a much better idea. Reward the child for desirable behavior, and punishment can only be given only for extremely inappropriate behavior. In that case, punishment must be quick, severe enough to curtail that behavior, stop enough, must be linked with that undesirable behavior, so that the mental cognitive learning, the associative learning takes place, and has to be explained why this punishment is there. Like if you're giving a time out for the child, then to explain that, okay, we are putting you back for half an hour in this room because this is a behavior which we don't want. I know you are a very good child and you can do very good behavior. You're going to be rewarded for that. Link the punishment with the reward. Don't just leave a punishment, but occasionally you have to use it, very rarely. Much more liberally used reward paradigms, they work. These are generally overall broad principles. Okay.
So, the talk has been so impressive and so thought-provoking. We do, feel that it should go on. Maybe we can focus on many of these issues again. And you have actually touched upon so many issues, and you have actually suggested remedies and also prophylaxis for the third wave, what we should be doing. So I think thank you very much, Dr. Basu, for joining us today. And I think your talk will really help the children fight these various problems that they are having because of COVID. Thank you very much.
Thank you very much, Madam, Dr. Meenakshi, and all those who have listened to this talk. Thank you very much. Pleasure to be here. Thank you. Bye.
Thank you. Thank you so much.